Good morning. Today I am going to perform a PRS procedure, that is a platelet-rich stroma procedure for a 60-year-old lady. Suffering from knee osteoarthritis. She is a resident of Chennai and these are her x-rays, standing weight-bearing x-rays AP, lateral and merchant skyline views. This is the left knee and this is the right knee. I'll be doing the procedure for this left knee today. You can see on the standing AP view that she has got narrowing of the joint space on the inner side of the knee. This is known as the medial compartment of the knee, and so she's got medial joint space narrowing. In addition, you can see bony spurs here, and at the top and bottom of the patella on both the sides here. And there are also prominent bony spurs at the back of the knee and at the top of the leg bone. Same provides on the right side, but we are not doing the procedure for the right side. In this patient, she has got inner joint space narrowing on the left knee and outer joint space narrowing on the right knee. So this case is not a classical case of osteoarthritis. In a classic case of osteoarthritis, the most common form, there is joint space narrowing on the inner side and you get bow legs. But here, she's got a bow leg on the left side and a knock knee on the right side. So this is called a windswept deformity. These are the merchant skyline views, and you can see spur formation on the outer aspect of the femoral bone here. This is the patellofemoral joint. These x-rays are typical of osteoarthritis, but different because they don't have the classic bow leg deformity. In osteoarthritis, this joint space narrowing is caused by the wearing away or the thinning of the articular cartilage. Articular cartilage is the lining at the end of the long bone. This is the femur bone and the tibia bone. It acts like a cushion or shock absorber. When the articular cartilage is intact, it measures about 3 to 4 millimeter, and this would, you can call this space as a probably slightly reduced joint space, and this may be a normal joint space. So when the cartilage thins out, the bones come closer together and you have this typical joint space narrowing on this side.
A knee replacement becomes necessary when the cartilage lining of the joint gets worn out. Cartilage, as I will show you in this model, this is the model of a knee joint. This is the lower end of the thigh bone or femur bone. This is the upper end of the leg bone or tibia bone. Here is the joint. The joint is lined in real life by this whitish material called as cartilage. When it is healthy, it acts as a shock absorber. When the cartilage, known as articular cartilage, gets worn out completely, then a knee replacement becomes necessary. Now I will show you a model of a knee joint in which the cartilage has begun to wear out. This is the model of a joint where you can see that the shiny white cartilage has started to wear out in patches. You can see patches of exposed bone where the cartilage has disappeared. This is a picture of early osteoarthritis. Now I will show you a model of a more advanced and destroyed knee. This is the model of a knee joint which is more advanced in degeneration. Here you can see that the bone is exposed to a more extent. You can hardly see any patches of the white cartilage. The patient whose knee is looking like this is going to be experiencing a lot of pain. There will be some, may or may not be some swelling. He will have difficulty in walking, and he may want to seek a permanent solution. At this stage, the quality of life is affected very much.
Till now, it was thought that osteoarthritis is a wear and tear phenomenon due to wearing away of the joint cartilage due to aging, obesity, deformities, injuries, etc. But of late, it is being recognized that osteoarthritis is not only present in the weight-bearing joints like the knee and the hip, but my patients and several of other patients also complain of pain in their fingers. So osteoarthritis is also affecting non-weight-bearing joints like the hands of the joints of the finger, etc. So it is being realized that osteoarthritis, there are other factors involved in it, and that is where the role of PRP or PRS is important. So in addition to the mechanical aspect which causes joint pain, there is also a swelling inside the joint due to a fluid accumulation. This fluid accumulation is there, occurs because of poor nutrition of the cartilage. Fluid accumulation occurs due to outpouring of fluid from the joint, from the adjacent bone of the joint, that is the tibia and the thigh bone of the femur. This fluid contains harmful chemicals called cytokines. A couple of these are called IL-6, interleukin 6 and TNF alpha, tumor necrosis factor alpha. And then there are also other chemicals released from the white blood cells known as metalloproteinases. All these perpetuate the inflammation and cause persistent inflammation and swelling and pain. So in order to treat the many factors of osteoarthritis, it is important to address each of these conditions. First goal is anti-inflammatory, and that is where PRP and PRS work. PRP and PRS, platelet-rich plasma and platelet-rich stroma, contain anti-inflammatory factors. They also contain immunogenic factors, that is, which suppress the immunogenic reaction inside the joints due to breakdown of the joint cartilage. And the cells in the PRP and PRS, mainly from PRS, these cells are called MSCs or medicinal signaling cells. These medicinal signaling cells, when injected into the joint intra-articularly, they don't perform any direct role of regenerating cartilage. They talk to these cells inside the joint. There are reparative cells inside the joint which can form bone and cartilage. In the case of osteoarthritis, the cells are called chondrocytes or cartilage forming cells. So these cells injected from outside in the PRS, platelet-rich stroma, which have got multi-potency, and they will talk to the cells inside the joint, and this function is known as joint talking to other cell-to-cell communication. This function is known as a paracrine function. So the outside cells talk to the cells in the inside and signal to those cells to form cartilage. So a limited regenerative response occurs. So the anti-inflammatory, anti-immunogenic, and chondrogenic properties of platelet-rich stroma is what leads to the combined effort. The anti-inflammatory lowers the swelling and that decreases the pain. The chondrogenic property kicks into place immediately afterwards and leads to regeneration. That leads to the sustained pain relief over a period of years. And anti-immunogenic also kicks into action after some time, and that will also curtail the inflammation within the joint. So this is the newly emerging properties of osteoarthritis, and it is important to address all these three components. In addition to treating the joints, if the patient has got other problems like diabetes mellitus, type 2, pre-diabetes, that is the earlier form of diabetes mellitus, then people with obesity, high blood pressure, all of them are having a metabolic syndrome. So it is important to address these other factors also by attention to the diet. A proper diet and exercise will help to decrease the obesity and also to reduce the pain and swelling of osteoarthritis. Thanks for watching. Hope this information is useful. If you are suffering from knee joint pain, then consider these factors. Try to lower your weight by eating less carbohydrates. If you've got hypertension, go for take a walk. Eating of diet lower in carbohydrates will help to improve the metabolic syndrome and control your blood pressure and diabetes. Bear this in mind. Restrict your eating to the 8-hour window so that your insulin doesn't shoot up from time to time. Cut down on sweets, sugar, and soft drinks like Pepsi, Cola, Coca-Cola, and even fruit drinks. They all cause your insulin to spike. Keep that in mind. And if all these fail, then you are welcome to seek a PRS injection in Chennai. Hope this video will help you and increase your knowledge of osteoarthritis. I do PRS procedures in my clinic, which is known as the Madras Joint Replacement Center. You can see more patient testimonials in my YouTube channel. If you like this video, like it. If you want to be notified about new videos whenever they are posted, subscribe to my channel Madras Joint Replacement Center and press the bell icon to receive all notifications. Thanks for watching. I will see you in the next video. Bye.